Hi, I just wanted to take a moment to thank each and every one of you for doing everything humanly possible to stay safe and healthy during this horrific COVID-19 pandemic. I especially want to thank all of our healthcare professionals for their bravery, for their sacrifice. They are saving lives each and every day. As I look across our parking lot, I'm in the Freehold office, and there's Central State. Outside on the lawn, it says, "Heroes work here." And no truer words have ever been said. True heroes are every day, are saving lives. Yes, they lose some, and that is tragic beyond words, but they're doing everything humanly possible to make people well. So I want to thank them for that. I want to thank the first responders. The men and women in uniform, the cops, the people, fire, EMT, all of them, for being on the front lines again, especially during this crisis, putting themselves at further risk of getting COVID-19. They are just amazing. They always are, but even now during this crisis. Then there's people like truckers, people who work in supermarkets, those who provide our food. They are doing amazing things, and some are sadly getting sick, but they're doing it, and they're doing it so well. We owe them our greatest thanks. Today a lot of people have died, so we do all need to offer our prayers, our condolences to the family members. And then there's those people who got very sick, got well, and now are suffering complications. So, part of the challenge is to find a way of mitigating those complications going forward. Please know that my staff and I are working 7 days a week, around the clock. We are on the phone nonstop, trying to make connections with people, trying to find personal protective equipment, PPE as they call it, to try to make sure that the gowns and the masks and the like are in sufficient supply to mitigate the danger. We're also working on legislation. I've introduced a few bills that I think will make a difference, but the big bills, there have been several of them now, that have been enacted, have really provided a bipartisan, bicameral, working with the president to try to address this in a very comprehensive way. One of those, tomorrow, I'll be back in Washington. There's a bill that's already passed the Senate, it'll be up tomorrow, that replenishes the Paycheck Protection Program, which is out of money. Very quickly, it ran out of money, 17,000 loans, all of which will be turned into grants. If the employers keep their people on board and keep paying their salaries by way of the loan, which becomes forgivable as long as they follow the rules. That has kept, according to our Secretary of Commerce, about 30 million people still getting a paycheck, who otherwise would have been unable to pay their own bills. So we're trying to keep businesses alive. This is a bridge so that when this horrific sickness, this virus has been vanquished, although we know we have a threat of it coming back, we will at least have our businesses intact so that those salaries and all of the good things that people provide to our economy can pick up and go again. There's also a lot of money in this bill, as there was in the last, to make sure our hospitals are solvent. Much of what the hospitals do, much of the revenues that they garner comes from elective surgeries. Now, elective is also essential. These are surgeries that must be done, but by law or by executive order, they've been put, they're not being done. So that revenue has really hurt the hospitals. So another tranche of money is being made available to our hospitals to keep them solvent, to pay the salaries of the doctors, the nurses, the LPNs, and everybody else that provides this critical care. And that too will be passed tomorrow. And I think by the end of the week, the president will have signed this new important coronavirus COVID-19 emergency legislation. So thank you. Keep striving. We're going to get through this, and we're going to get through it together.